Andreas is full professor of molecular cardiology at the University Medical Center Mainz. He has extensive experience securing research grants from both the pharmaceutical industry and public funding bodies. He serves on the editorial boards of several scientific journals and is full editor of Redox Biology. His expertise focuses on redox biochemistry, oxidative stress, and environmental research in cardiovascular disease. And he's going to present us MARKOPOLO project, which is composed by 15 partners from Germany, Italy, Lithuania, Serbia, United States, Cyprus, Luxembourg, Finland, and Denmark.
Thank you so much for the introduction. So is this the remote or? Yeah, okay. Okay, so therefore I think I already told it once, MARKOPOLO stands for Markers of Pollution and has a double meaning because also, despite the fact it's written differently, we also refer to the famous discoverer, Marco Polo, and want to discover new ground in environmental research. You have already given a nice introduction, Chris, about the composition of our consortium, so therefore I don't need to say much there. The overall approach in scientific challenge and context is that we want to go from the brain effects of especially noise and particulate matter exposure there with a focus on ultrafine particles, elucidate the uptake processes of the particles in the brain and the effect of air pollution and noise on stress reactions in the brain, which is then translated to other organs, especially the heart, where we focus on. So therefore the focus especially is on the brain-heart axis in our project. And this will be tackled by doing cell culture exposures with particulate matter to gain specific insight into the effects of different cell types, but also look at the organ damage and the interaction of the organ damage. And there especially look for targets where we think it's a link between the brain, heart and lung. And this is monoamine oxidase and brain-derived neurotrophic factor, which are important mediators of this brain-heart signaling especially. So therefore we have this preclinical level with the cell culture model, which is complemented by a computational approach, predicting damage of particulate matter in the epithelial lung lining fluid. Then we have a very ambitious animal part, which I will introduce a bit more later. We also have, of course, mechanistic insights from humans, where we do omics in samples. This should be then projected, the findings, to the more general population using computational models at a global level and also classical health association approaches by epidemiology. We also plan for interventions with healthy diet and exercise in smaller interventional cohorts, and all of the insights there should then be put together by integrative modeling bioinformatics approach, and also using social sciences we will gain more insight into the knowledge transfer processes, which is also, I think, very important to understand this better, especially the knowledge transfer processes in different political contexts, what we can easily do by the partners in all of the different countries, and also want to build success metrics for these knowledge processes then. And overall, we hope then to be able to make better recommendations to policymakers, organize training courses for healthcare professionals, and contribute to clinical guidelines also. A focus of Marco Polo are knowledge gaps. There we identified especially that noise-mediated health effects is underrepresented in clinical guidelines. Then also the legal exposure limits for ultrafine particles have to be redefined because we know more and more that those are the most detrimental particles. The combined effects of particulate matter and noise are largely ignored, despite the fact that we know more and more that they are there and they play an important role. Also, we have limited understanding on ultrafine particle exposure and the harmful effects, especially effects on the brain. Then the brain-heart axis is a really big focus in Marco Polo because we think this could explain a lot of the open questions. And there is in general insufficient experimental in vivo research. We all know that animal research, for example, gets more and more complicated due to more and more stricter regulations. Then there is limited knowledge on noise particulate matter effects on vulnerable groups, which is also a knowledge gap in the focus of Marco Polo, and the knowledge transfer processes and success metrics for that. I just want to show you some highlights and examples how Marco Polo partners did work on these research gaps in the past. For example, Mette Sørensen, using the Danish national cohort, came up with one of the first multi-exposure models where she also then calculated cumulative risk index from different exposures, ultrafine particulate matter 2.5, noise, lack of green space. Martin Rösli was involved in elucidating the hazard ratio for acute coronary syndrome patients and noise on top, and found that the noise exposure curves get steeper with the patients as compared to healthy individuals, speaking for additional and additive harm in the patients. And then finally, another highlight was the first publication now on the global exposure model to ultrafine particles, and there the colleagues from Max Planck calculated the cardiovascular disease burden at a 10 on 10 kilometer resolution. They now want to do it at 1 on 1, and they came up with a really worrisome value of 5.6 million cardiovascular disease at a global level per year, mediated by ultrafine particles, which is quite a lot. Our scientific approach is highly interdisciplinary and focuses on cardiovascular diseases, but also metabolic diseases and mental health conditions. And we want to use experimental and computational models in order to improve preclinical, clinical, interventional, and epidemiological studies. Especially we want to identify disease-relevant biomarkers and understand the molecular mechanisms of diseases of the brain, lung, and cardiovascular system. Just to give you some highlights of the scientific approach, our animal models comprise 2 different exposure systems that are able for combined exposures. So the one in mice is highly flexible. There we can use almost any kind of particles. Whereas the one in Finland is, let's say, more real world because they have a cast burner system, and both of them are equipped now with loudspeakers, so therefore enabling co-exposure studies on noise and ultrafine particles. We also have a set of quite advanced functional insights, echocardiography, also stretching mode of isolated cardiomyocytes, and also imaging at the cell level, or using clear tissues and light sheet microscopy that enables 3D models in the brain, for example, for different targets. Then we have the large cohorts, Swiss national cohort with more than 8 million health data sets, and the Danish one with more than 5 million health data sets. And this, of course, enables then also to do reliable health outcomes for vulnerable subgroups that are maybe not so numerous in the cohort, and enables multi-exposure approaches as well. And we have an ultrafine particle measuring campaign with a car that is sensor equipped driving around in order to generate address level data for the ultrafine particle exposure. Then we have the interventional cohorts, NoxyCard and MedScreen. NoxyCard is an acute noise exposure study that focuses on obesity additive effects, and the MedScreen study is a study that is a bit larger, addresses chronic particulate matter, ultrafine particle and noise exposure effects, and focuses on metabolic syndrome. And there we also plan for interventions by healthy diet and exercise. Then we have the computational models, especially the one for global exposure health associations using the EMAC weather model and the global exposure mortality model developed by a consortium around the colleagues from Max Planck and Cyprus Institute. Then we have this cell-based lung damage prediction model that is developed by Max Planck colleagues. You see it here also, how it roughly works, if you look then in more detail at the slides. Then we want to do advanced omics, including redox phosphoproteomics, spatial epigenetics, and DNA methylation and targeted metabolomics. Especially the first two are approaches that were not used so much in the past. We have a strict decision tree for the omics, preventing waste of money and samples, so therefore we do always a fast screening, and if this fails and does not generate measurable differences, then the more sophisticated, more expensive methods will not be applied. Then we will have an overarching advanced bioinformatics approach that uses preclinical RNA-seq data and also the new omics data generated here. Will cover a lot of different interventions also, therefore probably giving a lot of deep mechanistic insight. And in the end, we will then also look for an overlap of exposure omic signatures with existing diseasome maps in order to identify these disease-relevant biomarkers. And finally, we have this framework analysis for the knowledge transfer and legislative processes. So where are we now at the moment? The mouse exposure study started, or the exposure models are in the last finalization of setup. The measuring campaign for the ultrafine particles is in progress at different places. The initial ultrafine particle exposure cardiovascular disease incidence modeling was published already, and the downscaling to 1 kilometer resolution is in progress. Initial proteomic analysis of previous frozen samples that we collected from the different partners on quite different conditions is completed in 3 tissues, lung, brain, and heart, and yielded really novel ideas and concepts that we are at the moment evaluating and preparing for publication. And finally, also the initial bioinformatical analysis of previous RNA-seq data for the overarching bioinformatical approach is in progress. Our key expected results are deep mechanistic insights into disease-relevant pathomechanisms, identify new biomarkers for precise assessment and early detection of at-risk groups, computational model of PM2.5 mediated oxidative stress reactions will be also used to inform the health association studies. We plan for implementing oxidative potential score into these health association studies. These will allow then also comparison of different approaches, because we do the empiric way and the computational way, so therefore the head-to-head comparison will be interesting of these two approaches, and we will generate novel tools such as gene expression web-based explorer, exposure models, oxidative potential for particle toxicity, and the MET score. And in the end, we hope also to have a better understanding of the knowledge transfer processes from science to decision makers after the social science study. So what is the expected impact? We have impact at the scientific level. So therefore, we will have investigations of the health impacts of noise and air pollution. We will have the impact of on vulnerable groups and improving fair data practices. MARKOPOLO also aims to uncover causal mechanisms for effective interventions and assess the role of ultrafine particle matrix in disease risk. And we will also work hard on better ultrafine particle emission standards and limit values. At the technological level, of course, we want to improve the disease burden estimates by refining especially the exposure response functions. We want to identify key biomarkers for noise and ultrafine particle exposure. And finally, we want to improve risk prediction, validate interventions, and provide also innovative tools and technologies for better policy making. And at the socioeconomic level, we want to support regulatory efforts by providing evidence for risk assessments, guidelines, and standards. We want to raise awareness, of course, also in the general population, reduce healthcare costs in the middle to long run, and improve quality of life. And some of the partners also will take care of interaction of temperature, climate effects on air pollution especially. And with this, I would like to finish and show you the web page.